I welcome you all to the module 12 of this course. So, in module 12 we are talking about how positive psychology informed interventions can be applied in the context of therapy and counseling. So, today's lecture is lecture number 31 and this is the last lecture of this course also, and this is the second lecture of this module. So, today's lecture is titled as positive psychological interventions and models of therapy. So, we will talk about some of the models of positive psychotherapy. So, before we talk about today's lecture, let me give you a brief recap of the last lecture. So, the last lecture was also part of the same module, and in that context we have discussed how positive psychology is relevant in the context of counseling and psychotherapy. So, we discussed some of the broad applications of positive psychology and how they can be applied in the context of counseling and psychotherapy. We also discussed how positive psychology can help us or give us a framework to conceptualize client and conceptualize what should be the outcome or expectations of outcomes in therapies and counseling. In that context, we have discussed two important concepts. One is the forefront approach model that looks into all the spectrum of experiences of a client, including both negative and positive. And also we discussed the complete state model of mental health, how focusing on both symptom reduction as well as promotion of well-being as a complete state of mental health model, how that can be integrated in the context of counseling and psychotherapy. At the end, we discussed the process of positive psychological assessment, how we can assess some of these positive psychological traits and qualities or states using assessment instruments. So, these were the things that we discussed in the last lecture. We will continue from that aspects what we have discussed in the last lecture, and in today's lecture we will be focusing more on specific positive psychotherapy or therapeutic strategies that are based on positive psychological models and understandings. So, more specific interventions and therapeutic models will be discussed in today's lecture. So, we'll talk about what is positive psychotherapy and what are its processes. We'll also talk about, we'll give more specific examples of positive psychotherapy like strength centered therapy, well-being therapy, hope therapy and so on. And at the end, since this is the last lecture of this course, we'll have some reflections what we have learned throughout this journey. So, let's start today's lecture. So, when we talk about positive psychology, and we have already discussed that how it is relevant in the context of counseling and therapy in the last lecture. Now, there are many specific positive psychology oriented therapies and counseling models available which can be used to promote clients' well-being. So, some of these are listed here like strength based counseling, strength centers therapy, positive psychotherapy. It is a very broad term that includes most of these things. Quality of life therapy, well-being therapy, hope therapy and so on. So, we'll discuss few of them in today's lecture. So, when we talk about positive psychotherapy, it is a broad umbrella term under which most of this which we have listed will come under that broad umbrella term. So, positive psychotherapy or PPT is basically an empirically supported therapeutic approaches that focuses on building client strengths, foster positive emotions and enhancing meaning in life to reduce psychopathology and promote happiness. So, positive psychotherapy more specifically focuses on promoting well-being, building strengths in client, fostering positive emotions. So, most of the concepts that we discussed throughout this course are focused on in terms of how to promote all these positive psychological concepts and using interventions from the positive psychological theories and so on. So, that is called positive psychotherapy, and these are based on evidence based and based on empirical research and supported by evidences and so on. So, unlike traditional therapies that primarily address problems and deficits, positive psychotherapy integrates both positive and negative aspects of client experiences. So, that is the major difference between the traditional psychotherapies and positive psychotherapy. So, in positive psychotherapy, in addition to symptom reduction and diagnosis, additional focus is given where promotion of well-being and positive states are given importance. For example, when helping a client overcome trauma, a therapist might highlight the strengths develop as a result of adversity. For example, in the context of positive psychotherapy, if somebody is, a client has come with the problems of trauma and its impact and how to overcome that. So, in addition to dealing with the trauma and coping with the traumatic problems, positive psychotherapy will also focus on and try to understand, as a result of this traumatic experience, was there any development of certain strength within that person. The concept like post-traumatic growth and other thing will be assessed also. So, that is how the approach is little bit different from the traditional psychotherapies. Another example, a client struggling with guilt over harming a family member might be encouraged to reflect on times they engaged in prosocial behaviors towards the person. So, it is like balancing both the aspect. Client will come with a problem, you also show that there are strengths and positive dimensions to their life also. So, there is a dual focus in the context of positive psychotherapy on strengths and challenges. Both focus are given. What are the challenges and the problems faced by the client, as well as what are the strengths and positive aspects within them or in their environment. So, all these things are basically incorporated in the positive psychotherapy. Now, the core assumptions or some of the understanding that are like as a background in the positive psychotherapy, these core assumptions include, the one thing is that when we look at a client, so positive psychotherapy, when you are practicing that, you have a certain assumptions about the client, or when you go through or implement traditional psychotherapy, people have certain assumptions. So, what are the assumptions of positive psychotherapy? One is there is an inherent capacity for happiness and mental illness. So, every human beings, whether they are coming with the symptoms of mental illnesses or problems, psychological disorder, but the same person also has an inherent capacity to become happier and experience higher well-being. So, that is one of the assumptions. Based on that, promotion of well-being is always focused in the positive psychotherapy. So, positive psychotherapy assumes that all individuals have the potential for both mental illness and happiness, which arises from interaction between the person and their environment. Every human being are capable of both the things. So, both should be focused on. So, that is one assumption. Second is the genuineness of strength and positive emotions. So, positive psychotherapy assumes that strengths and positive emotions are as real as or as significant as weaknesses and negative emotions. So, obviously, the client will come with problems and negative emotions and weaknesses. They are real, no doubt about it, but positive psychotherapy also says the client's strengths and positive emotions are also as real or as significant as their weaknesses and negative emotions. Both are the reality of the same individuals. So, both should also be focused on. So, addressing this positive is essential for building strong therapeutic alliance and creating foundation for effective treatment planning. So, these are basic assumptions with which a positive psychotherapist looks at or conceptualize a client. Now, some of the positive psychotherapy can be done in many ways, like including the various aspects of positive psychology. So, we will just give example of Rashid 2008, he discussed some structured positive psychotherapy. So, this is just one way where one can integrate positive psychology into therapy context. So, in that context, this is a very structured positive psychotherapy. So, we have some evidences for that. So, that is why we will be discussing this particular process of positive psychotherapy. So, this positive psychotherapy as developed by Rashid, it has 14 sessions, idealized sessions, each focusing on specific themes or construct from positive psychology. So, in a general, it has a 14 sessions and each session focuses on one positive psychology constructs, that is a client is educated about different positive psychology construct in each sessions, and this is and it is focused on and how it is promoted. So, each of these 14 sessions addresses a unique positive psychology construct, such as one session may be on gratitude, one session may be on strengths, one session may be on optimism, one session may be on meaning, and so on. Then clients are given homework assignment to reinforce the themes discussed in the therapy. whatever they have understood in the sessions, they are given additional homework to integrate those understanding. Now, these exercises are practical and designed to help clients apply positive psychology principles in their daily lives. So, basically these are designed so that everybody can apply them in their daily lives. So, these are like easy to apply strategies, that are taught to them, and so that they can apply them in their daily lives. So, these sessions are generally designed to be flexible. You cannot be very rigid about positive psychology construct in terms of teaching. So, these are designed to be more flexible and tailored for the individual needs. Based on the problems of the individuals, sessions can be changed here and there based on the need of the individual. Ensuring that the length of therapy, homework assignment, session focus are customized to address the client's current concerns. So, obviously, there are some broad approaches which will be same, but based on the client problems and the personality characteristics and so on, things can be flexibly kind of trained or given focused based on the client's need and so on. So, Rashid emphasized that positive psychotherapy should not overlook or invalidate clients' negative or distressing experience. So, this is very important. Positive psychology never just directly jump into the positives without focusing or discussing about the client's problems and weaknesses. That is never the case. In psychotherapy always, since clients come with a problem is also addressed, but it is an additional approach or focus that is given on the positive psychology constructs. Instead, therapists must validate these experiences while simultaneously working to cultivate positive emotions. So, these negative emotions and problems are always validated, and they are also given necessary support for them, but additionally they are also given strategies and intervention to cultivate positive emotions, strengths and so on, so that they have a more meaningful life and so on. So, the flexibility of positive psychotherapy allows therapists to adapt the appropriate approach to suit the client's specific needs, ensuring a personalized therapy experience. So, this is one example of how positive psychotherapy can be implemented, and this is like more evidence based, and this has more structured program. So, this is just one example we have discussed. This is how it can be implemented in the proper standardized therapy sessions. Now, there are some empirical support also there for positive psychotherapy, because positive psychotherapy, now what we have discussed is a 14 session. Many short positive psychotherapy sessions are also people have also implemented, and there are empirical support to that also. So, efficacy of this positive psychotherapies has also been reported in many research studies. For example, in the context of individual positive psychotherapy for depression, Seligman and colleagues in 2006 found that individuals' positive psychotherapy significantly reduced depressive symptoms and led to higher rates of complete remission compared to the treatment as usual, and treatment as usual combined with antidepressant drugs or medications. So, they found when positive psychotherapy principles were included in the therapy, the outcome was much better as compared to just traditional therapies or therapy with some medication. So, this is what was reported. Additionally, also positive psychotherapy enhanced client happiness levels, demonstrated its dual focus. So, it also promoted happiness and well-being and so on. Some other evidence are also available in the context of group positive psychotherapy for college students. In a study with college students who are experiencing mild to moderate depression, group psychotherapy or positive psychotherapy actually resulted in greater reduction in depressive symptoms and increased life satisfaction compared to no treatment control group. So, these benefits were actually sustained for a year after the intervention. So, these are not like short term thing. The effect was sustained for a long time. Even after 1 year, the effect was there. So, in the group session also the evidence was available. Even in the context of children also, some positive psychotherapy evidences are available. Evidence for their efficacies are also available. So, a brief version of group positive psychotherapy was also administered to middle school students, leading to a significant increase in their well-being also. Some web-based studies are also available, where many of these homework exercises used in positive psychotherapy have been validated through web-based studies conducted by Seligman and others. further also supported their effectiveness. So, there are in a diverse context positive psychotherapy has been implemented, and most of the evidence shows that they are effective and creates or makes significant contribution in terms of promoting well-being and so on. Rashid also in 2008 concluded that positive psychotherapy has demonstrated efficacy when a large number of studies were combined with large to medium effect sizes. In meta-analysis, it shows that the effects are large to medium, so which is like significant impact, making it a robust and evidence-based approach to therapy. So, this 14 session framework of Rashid actually combined with validated homework exercises provided a structured yet adaptable method. So, this provides a structured method which can be adapted based on the needs of the clients and so on. Now, we will talk about some examples of specific positive psychotherapy where specific constructs of psychotherapy are given importance. The typical process that we discussed now is basically it includes many constructs together in the positive psychotherapy. Now, we will talk about some therapies which focus on specific concepts. If a client needs, let us say, only strength development, or if a client needs only hope, increase of or enhancement of hope, then there are specific psychotherapy examples are also available where specific constructs are given importance. So, first we will talk about strength centered therapy. So, this therapy focused on developing strength. So, these are not generalized positive psychotherapy focusing only on specific constructs. So, this was proposed by Wung 2006. So, we will talk about how this is kind of structured. So, strength centered therapy or SCT is a counseling model grounded in social constructionism, which says that knowledge is shaped by social consensus. So, here the basic idea is that when you talk about knowledge, it is a kind of shaped by social consensus. Knowledge is not just someone giving to someone else. So, it is a kind of consensus through which knowledge is kind of shaped. So, it leverages character strength and virtues proposed by Peterson Seligman that we discussed in detail in the earlier modules. So, it takes the ideas from that VIA survey model of character strengths and virtues to facilitate this change or kind of develop those character strengths and virtues. So, that is why its focus is very specific on the character strengths. So, a key principle of this therapy is that clients' subjective views of their own well-being and pathology are more important than expert opinion. So, it is very important to understand how client is perceiving their problem, what is their perspective, how they look at their well-being, how they define their concept of well-being and happiness, how they define their problems and so on. So, that is why it is we call it as a based on social constructionism idea that in this particular paradigm that subjective views of the clients plays very important role, because he is the person who will either change his views or we have to look through that person's perspective to understand what is happening and how what can be done. So, therapists and clients collaborate to create a new meaning for the client experience. So, therapists just facilitate the process and by understanding the client's perspective. So, they together expand the understanding or gives a new perspective to the understanding of the client to expand their concept of strengths vocabularies, because the client may have some limited ideas. So, therapists facilitate that process in order to expand that vocabularies of strength, helping clients to focus on positive and adaptive aspects of their life. So, now this particular strength centered therapy has 4 phases in terms of how it is implemented. First is explicitizing phase, then envisioning phase, empowering phase and evolving phase. So, let us look what is done in each of these phase very briefly. So, when we talk about explicitizing phase, so this is the first phase in this therapy. So, in the goal of this phase is to help clients identify and name their existing character strengths, because client may have some ideas about what kind of strength the person has, he or she has. So, the therapists facilitate this process of identification using narratives or standardized tools, whatever is available, So client is the goal of this phase is that initially that client should understand what are the existing strength he or she has. So in that process, therapist validate clients' concerns while highlighting their strengths. So therapist highlights what kind of strength they have based on the analysis. For example, a depressed client showing up for therapy demonstrates hope and courage. So even though the person may be depressed, he might have come for getting help for the depression, but therapist may find that this person has certain strengths, like this person may be very hopeful and courageous in some sense. So therapist can focus on that also. Reframing perceived flaws as strengths. Many times a lot of flaws that we collectively assign or just level some individuals with certain flaws, sometimes that flaw itself may have certain strength aspect. For example, a child with ADHD can be labeled as a dreamer or may possess creativity. So many times some of the child with ADHD where they lack attention, they cannot pay attention for a long time, or there is some attention issues, but lot of this child may also possess lot of creativity and so on. So the same problem, but there may be some positive dimensions to it. So therapists can focus on that also. In that process, to facilitate that process, certain tools also can be used, like positive psychological assessment measures like VIA inventory and so on. All these standardized tools can also be used to help client understand what kind of strength they have and leverage on that. So the goal of this explicitizing phase, the outcome goal is client become aware of their strengths, which can be leveraged in the therapy. So this phase, the focus is that to make the client aware of the strengths that they have. So this is the first phase. Second phase is envisioning phase. The goal of this phase is the client should identify strength as they wish to develop and envision how this strength can help achieve their goal. So in the first phase, they identify what kind of strength they have. Now in this phase, the client, after identifying them, they are also asked to what kind of strength they wish to develop and how can they use those strengths to achieve their goals. So like little bit extension of the first phase. So how this is done? Therapist may ask question like, what strength would you like to develop? What strength the person may be interested in developing in their life, or what strength would help you reach your goals? So this kind of questions may be asked, and they may also ask to give sentence completion tests such as I am more likely to achieve my goals of dash if I am a dash person. So they will have to focus on their strength, what kind of person they are, what kind of strength they want in their life to achieve their goals and so on. Can help client articulate desired strengths and so on. Therapists also ensure their understanding of strength levels align with the client's meaning. So that is why this therapist should be very sensitive to in order to understand how the client is leveling things and so on, so that there should not be different worlds for therapist and clients. They should match together. So the outcome of this phase is client set intentions for strength development and connect this to their goals. So this phase, the client intend to develop whatever strength they have identified, and they try to connect them how this can help them to achieve goals and so on. So this is the second phase. Third is empowering phase. The goal of this phase is client experience increased motivation and empowerment as they use their strength to positively impact their lives. So that is the goal, how to empower the clients by using these strengths in their life and achieve their goals. So to empower them through these strengths. So that is the goal of this phase. How it is done? Therapists help clients develop habits that cultivate strengths. So therapists help clients to develop certain habits so that they can cultivate those strengths more and more in their life, like volunteering to build kindness and generosity, for example. Clients also connect with supportive individuals who encourage their strength. Always it is easy to develop strength when there are supportive people around you. They also help you to in that direction. So therapists may connect them with those supportive networks. Therapists also can guide clients in exploring when strengths are useful and when they may become problematic, like excessive caution in preventing risk taking and so on. So, therapist looks into the nuances of that and educate the client. So, what is the outcome of this phase? Expected outcome, the client feels empowered to apply their strengths. So, basically they become more empowered, more confident that they will be able to use those strengths more effectively in the various contexts of their life. So, that is called empowering phase. The fourth one is called evolving phase. So, the goal of this phase is to make strength development a lifelong process. Now, strength development cannot be done in 1 or 2 sessions in therapy. It is a lifelong process, it is an evolving process. So, therapist needs to make sure that client is evolving in that process, more and more development, and the client is developing in that process of strength development. So, it is a lifelong process beyond therapy. In the real life it has to continue. So, that is the purpose of this phase. Here how it is done, the therapist and clients review progress, celebrate success and identify areas for further growth. Clients learn to use their strength to address future challenges and so on. So, the outcome, expected outcome, in this phase clients leave the therapy with a sustained framework for ongoing strength. So, the main motive of this phase is that client should be a framework. How can I evolve this strength in my life more and more, because it is a lifelong process. So, that is the objective of this phase. So, that is called client centered strength centered therapy. These are some of the significant steps involved in the strength centered therapy. Now, let us look at the another therapy that is also comes under positive psychotherapy. It is called well-being therapy. Now, well-being therapy is a brief and structured and directive treatment program designed to enhance psychological well-being. So, as the name suggests, focus is on enhancing psychological well-being. If you remember, we discussed 2 concepts in the first module. So, there is something called as a subjective well-being and something called as a psychological well-being. So, subjective well-being is more related to emotional well-being, and also it has life satisfaction component. Psychological well-being is more related to meaning in life, growth in life, autonomy and so on. So, this well-being therapy focuses on this psychological well-being or eudaimoc well-being part, how to promote that, and it is based on Riff's model. So, it was developed by Ruini and Faba, and it is based on Riff's model of psychological well-being, which talks about 6 dimensions of well-being that should be, so that increases psychological well-being in our life. So, when we talk about psychological well-being, these are the dimensions. If they are high, then our psychological well-being is also high. So, this includes Riff model, we have already discussed that also, but just kind of again talk about these dimensions. So, it includes Riff models includes the dimensions of psychological well-being as environmental mastery, personal growth, purpose in life, autonomy, self-acceptance and positive relationship with others. So, these are very important components in the Riff's model. We have discussed each of these components in detail in the earlier modules. So, I will not go to that part again. So, the goal of well-being therapy is to help client transition from low to high levels. So, client may have low score in many of these dimensions, all these 6 dimensions. So, the purpose of this therapy is to increase these dimensions in the life of the client. So, therapy is typically delivered over 8 sessions, and it includes client self-observation. They understand what is the level of this dimension within them. It also includes structured journaling, therapist client interaction to promote well-being and so on. So, basically this whole approach is to promote them. So, the client should understand what are these dimensions, what are the levels of this dimension in their experience, and how can they promote them. So, therapists facilitate these things. So, the core component of this therapy, well-being therapy, is it includes identification of well-being experience. First, the client needs to identify what is their level, where they stand. So, the clients are encouraged to identify and document instances of well-being in their lives, no matter how brief, small they are. They use a structured diary to record these experiences and rate the intensity on a scale of 1 to 100. So, this helps client become more aware of the moments of well-being and the circumstances surrounding them. So, it is a reflective exercise where clients are asked to identify, reflect on these dimensions of well-being in their life, even though they might have experienced it for a very brief amount of time. So, they use this structured diary method to record these experiences, and clients are asked to report their intensity of this dimension on a scale of 1 to 100. So, this is one aspect to it, identification. Second is assessment of psychological well-being. So, the mental health continuum long form, one scale based on Key's mental health model, which includes subscale of Ripp's model, can also be used to assess client's level of psychological well-being. So, there are structured questionnaires are available which are based on Riff's model of well-being. They can be used to actually assess. Apart from client's own reflection, standardized tools can also be used to get the scores on these dimensions for the client. Then it includes identification of cognitive barriers. So, clients are guided to identify thoughts and belief that hinders their well-being. So, these well-beings are basically hindered because of certain blockages in the thoughts or certain thought processes which are not productive. So, this phase is very similar to cognitive therapy techniques such as identifying automatic thoughts or irrational beliefs which are creating blockages or which are kind of hindering their growth in terms of experiencing higher well-being. So, these clients are kind of process is facilitated to understand that what are the cognitive blockages or barriers the client have in terms of why they are not able to experience higher well-being. Then cognitive restructuring and behavioral activations are done to reduce those barriers. So, therapists help clients challenge and refute faulty thinking by examining evidence for their beliefs and encouraging behaviors that promote well-being. So, basically here therapist encourages client to find out what are those automatic negative thoughts which are blocking them, and therapist facilitates how to replace them with more healthy and rational thoughts. So, it is very similar to what cognitive therapies are done. Then the very important aspect of this therapy is that education on dimension of well-being. The clients are educated about what are the important dimensions of well-being, what are the components of well-being that should be promoted. They should be aware of that, otherwise how can they promote. So, clients are educated about all these 6 dimensions of psychological well-being and encouraged to reflect on their functioning in each domain, and they are encouraged to see whether they have this dimension in their life or not. Wherever they struggle, therapists explore why they are struggling, what is the reason behind it, and how that can be removed. For example, how this is done. For example, all these dimensions, there can be low level of functioning and there can be high level of functioning or optimum level of functioning. The first dimension, the environmental mastery. Let us say if a client has low score on that, if they are struggling in this dimension, they will show the symptoms of client will feel difficulties in managing everyday affairs, will feel unable to change or improve surroundings context, is unaware of surrounding opportunities, lacks sense of control over the external world. They will struggle in dealing with daily difficulties or problems of their life if they have low environmental mastery. So, the goal is how to promote that. So, optimal level of functioning, how does it look like? So, the client, if they have higher functioning on that, they will have a mastery and competence in managing and everyday affairs, controls external activities, makes effective use of surrounding opportunities, able to create, choose context suitable for their personal. So, they will be more proactive and active in terms of changing environment according to the needs of their requirement in daily lives. So, this is how, let us say, one can identify symptoms of low level of this dimension and high level of this dimension. Next is personal growth dimension. If the person has low score on that, that means the person will have a sense of personal stagnation in life. They will feel they are stagnated, they will lack a sense of improvement and expansion over the time, feels bored and uninterested with life and so on. So, these are the symptoms of low personal growth. Person will feel stuck, stagnated, they will not feel expansion in their life, improvement in their life, they will feel bored, uninterested and so on. On the other hand, high level of this growth will be reflected with the feelings of continued development, seeing self as growing, expanding, open to new experiences, just opposite to the low symptoms. So, they will feel expanding in their life, doing more things, improving in their life, sense of realizing one potential and growing in there and so on. Third dimension, purpose in life. If it is low, the client will have a sense of lack sense of meaning in life. They will feel that life is meaningless, they are not doing anything meaningful in their life, has a few goals or aims, lacks sense of direction and does not see purpose in the past life and so on. So, these are the reflections of low purpose in life. So, they will feel that life does not have much meaning and purpose, they will not have much goals in their life, they will lack sense of direction in their life. These are all reflection of low purpose in life. High purpose in life will be just opposite to that. They will have high sense of direction, feeling there is a meaning to the present and past, holds belief that their life has a purpose, goal, direction and so on. Then comes autonomy. Here the lack of autonomy will be reflected by clients over concerned with their with the expectations and evaluation of others. So, they will be too much concerned how other people are concerned. So, they will not work out of their own choice. They will be too much concerned with how other people are judging, and their most of the behavior will be guided by how others are thinking about them. So, there is no sense of autonomy, they are always guided by others' expectations. So, that is a reflection of low autonomy. They relies on judgment of others and make important decisions. So, it is not coming from their own wishes and wills. They conform to social pressures too much to behave in a certain ways. So, these are all reflection of low autonomy in their life. On the other hand, the people with high autonomy, they will have self-determining independence, able to resist social pressure wherever it is required, regulate behavior from within, evaluate self by personal standards. So, they will be more guided by their own inner standards than too much of external standards. Self-acceptance, the next dimension. The low self-acceptance will be reflected by clients' dissatisfaction with their own self, disappointed with what has occurred in their past life, is troubled about certain personal qualities. So, wishes to be different from what he or she is. So, they have low self-acceptance, means they are not happy with the way they are, where their life is turning out to be and so on. High self-acceptance will be just opposite to that, where client will have a positive attitude towards their own self, accept his or her good and bad qualities, feels positive about their past and present circumstances of life and so on. Then comes positive relationship with others. Low level of that will be reflected when client has a very few close and trusting. So, they will have very low trusting relationship, less number of people in their life. They will find it difficult to open and feel isolated and frustrated in interpersonal relationship. They feel difficult to open and connect with other people. So, they will feel more like isolated and frustrated and so on. On the other hand, positive relationship, if they have high, client will have warm and trusting relationship with others, is concerned about the welfare of others, capable of strong empathy, affection and so on. So, these are the 6 dimensions, and one can find out whether a client is struggling in this dimension or they have higher scores on that. So, whatever dimension the client is struggling, the therapist can facilitate and promote those dimensions to enhance their well-being. Now, one of the important things therapists should be aware of is the cultural background of the client or cultural belief system of the client, because that can also influence the outcome. So, well-being therapy, it emphasizes that cultural sensitivity from the therapist part. For example, autonomy as a dimension, not every culture may focus on autonomy, especially the Western culture gives a lot of importance to the autonomy. Eastern cultures, a lot of this collectivist culture may not look at autonomy with a lot of positivity, because people are more socially oriented. Their connection with the groups and society and social norms plays very important role. So, in that context, in certain cultural contexts like collectivist cultures, people may not want autonomy as a part of their well-being. So, autonomy may not a true reflection of their well-being, because their well-being lies more in the social context, group norms, society norms and so on. So, one has to be sensitive about those things. Another dimension like environmental mastery also may have some cultural connotation to it. Clients from certain cultures that values going with the flow or focusing on the present may not prioritize too much controlling environment and goals. So, some cultures may not focus too much of controlling everything, but they may just like to flow with the way things are happening in their life, So, and a lot of the spiritual concept also can influence that. A lot of spiritual teaching doesn't talk about environmental mastery. So, one has to be sensitive about the client's background, not just blindly saying this is the ideal, So, therapists must adapt well-being, and it should be aligned with the cultural aspects also. The last one that we will be talking about is hope therapy. So, this is another therapy that is focused only on hope, building hope in the client, because lack of hope can lead to many negative consequences in one's life. So, many people may have this lack of hope in their life, which manifests itself into many problems. The hope consists of, we have already discussed about the theoretical part to it, just to give you brief kind of main component of the hope, so that we understand how this therapy works. So, hope includes three components. One is the ability to set clear goals, develop pathways to achieve those goals. So, first is you should have a goal, then there is a pathway to reach that goal, and the third is to maintain the motivation and energy to pursue them. People may have a lot of pathways, but they may lack motivation or energy to go towards or move in that pathways. So, hope includes that you should be able to maintain and motivation to and energy to pursue those goals. So, these three are present in your life, then you are generally, your life has very high hope. So, these goals can range from short term objectives to lifelong aspirations. Both pathways and agency thinking are essential for goal attainment. So, whenever we talk about hope, it is always in the context of certain goals, and goals, one has to have a pathways to reach them, one has to have a motivation to reach them, and so on. So, hope includes all the three elements. You cannot talk about hope in isolation. So, hope theory says that emotions are byproduct of goal directed thoughts, with positive emotions arising from perceived success in goal pursuit and negative emotion resulting from perceived failure. So, our emotional experiences are, a lot of these emotions are connected to the goal orientation and the result of goal achievement and so on. If we are able to achieve goals, generally it leads to positive emotions. If we fail to achieve our goals, it leads to negative emotions and so on. So, a lot of emotional components are connected to hope. So, this hope therapy, what is done? In hope therapy is a generally brief semi-structured approach designed to enhance client hope by focusing on goal setting, pathways and agency thinking. The focus is on these three components, how these three components can be enhanced and focused, so that the client experiences more hope in their life. So, therapists help client clarify goals, develop multiple pathways to achieve them, and generate mental energy to sustain in that pathways. So, this is the purpose of this therapy. So, there are different components of this hope therapy. Whenever we talk about some standardized therapy, there will be some standardized steps to follow that, as we have discussed in other positive psychotherapies. So, in the hope therapy, there are these four components. First is hope finding. It is about identifying and fostering hope in the client. Then hope bonding, building a strong therapeutic alliance to enhance hope. Third is hope enhancing, developing strategies to increase pathways and agency thinking, so that hope increases. And the last one is hope reminding. It is reinforcing hope through reminding of past successes and progress. So, these are the four steps that is followed. Very briefly, let us look into each of them. The first one is hope finding. Obviously, this is the main focus, that the client should understand what hope is all about, why a person is not experiencing hope, and what is the problem. So, the finding of hope is the initial stage of hope therapy. It aims to uncover the hope clients already possess, which can be built upon during therapy. So, client may have many hope, which they may not be able to achieve and so on. So, everybody has already a lot of existing hope related phenomena. So, therapists can focus on that as a starting point. Hope can manifest as a trait like general hopefulness, or a domain specific hope in a particular life area, or goal specific hope related to specific goals and so on. So, there can be different types or categories of hope. Some people just hope maybe personality characteristics, it could be based on certain domains of their life, like professional life, personal life. They may have certain goals and so on, and maybe very goal specific also. So, therapist first assesses hope. So, in order to find hope, one need to assess what kind of hope the client has. So, it can be used using certain measures, standardized measure or assess hope. It can be used using narrative approach, where the client can share their own stories of life, where they, in talking about their life and problems, they will unknowingly reveal their hopeful experiences or lack of hope, whatever it is. It can also be found out using hope profiling, where clients write some task of short story writing about their past and current goal pursuit, and from their hope profile of the client can be developed and so on. So, there can be different ways to assess that. So, this is what in the first phase it is done using all these processes, assessment methods. Hope, the therapist identifies the hope in whatever existing hope the client has. Then comes hope bonding. Hope bonding focuses on building strong, hopeful therapeutic alliance between the therapist and the client. So, basically the client bonds with the therapist, and this therapeutic alliance actually promotes this hope development and so on. So, collectively both together see the situations of their life. So, this alliance is crucial for fostering hope and achieving positive therapeutic outcomes, because then they collaborative goal setting. Client and therapist, they collaborate together as an alliance, and they set goals in terms of, like, basically therapist facilitate this process. Therapist engage client in the treatment planning and goal setting and so on, which helps client feel more comfortable and invested in the therapeutic process. So, they establish clear goals and generate multiple pathways and so on. So, collaboratively they set goals, pathways, and strengthen this bond and build hopes and so on. So, in that context, therapist's qualities are also very important. Hopeful alliance is fostered when therapists establish trust, demonstrate empathy, understand clients within and so on. So, these qualities are essential. If therapist lacks this quality, obviously he or she cannot form this alliance or bonding. So, this is the second aspect of this therapy. The third aspect is hope enhancing. So, hope enhancing aims to increase hopeful thinking in the clients who may lack hope in general or in specific life domains. So, through these other phases, the initial phases, the client and therapist identifies their problems or lack of hope in whatever areas they have. Now, they try to, in this phase, enhance the hope using goals, pathway thinking and agency thinking that we discussed earlier. So, goal development, therapists help client to develop clear, positive, specific goals. Pathway thinking, therapists teach client to break down pathways into smaller steps and think creatively about achieving goals. So, all the obstacles therapists address one by one. Agency thinking, therapists help client to increase motivation by exploring past successes and strategies that client has used to overcome. It encourages positive self-talk and focusing, enjoying the process of goals pursuit rather than just outcomes. So, client motivates, intervenes, the therapist intervenes at the motivational level to increase motivation to reach goals and so on. So, these are the things, all the three aspects of hope are, the interventions are done in this hope enhancing stage. So, client visualize, rehearse, goal pursue, take actions and so on in this stage also. The last one is hope reminding phase. It is the final stage of therapy. It focuses on teaching clients self-monitor their hopeful thinking and sustain high hope levels independently. So, teaching client self-monitoring is very important, because after therapy it is a lifelong process. Every kind of development is a lifelong process. So, beyond the therapy session, the client needs to able to monitor this. So, that is what it is taught in this last phase. So, it ensures that client maintain the progress achieved during therapy beyond the therapy also, and continue to apply these techniques. So, self-monitoring techniques are taught in this stage. Clients are encouraged to review personal hope stories created during the hope finding phase, identify hope buddy in their personal life for support and reinforcement during challenging times, reflect on past successful goals pursued and the strategies that led success, complete automatic thought records to identify, address barriers in their thought and so on. So, all these self-monitoring techniques are taught to the client, so that when they go in their real life after the therapies, they are also able to monitor themselves whether they are stuck or not, so that they can, what they can do in terms of keep progressing in that direction. So, therapist in that phase, in the basically they prepares for termination of the therapy, said by giving or developing post treatment goals and plan for potential setbacks, conduct daily hope checkups, so which involves setting simple daily goals, slightly more challenging weekly goals, and so on. So, this is how what is done in this phase. So, with this we end the content of the course. So, since this is the last lecture of this course, so we will just kind of summarize that what we have gone throughout this journey. So, we have come to the end of this journey of this course, applied positive psychology. So, if you look at what we have gone through, what is the journey is all about. So, in a very nutshell, we can say what we have done here is that we have delved deep into the science and theories of positive psychology, and we try to apply each of these theories into our day-to-day life context. And also we have discussed how these positive psychology principles can be applied in certain broad setups like workplaces, educational setups, therapies and counseling, and so on. So, in that context we said this is an applied positive psychology. We are not just talking about theories in this course, we also try to apply these theories in our day-to-day life, which includes personal life, professional life, using various interventional exercises throughout these courses. And at the end we talked about broadly how these principles can be applied in the context like workplaces, education and therapies. Now, we should remember when we talk about positive psychology, people just take it only talking about positive, positive, positive. Positive psychology is never talking about only positive things and never denying the existence of sufferings and negative states of human existence. So, it never ignores the pain for chasing only constantly happiness and so on. So, we understand that this part is already there, and it is the suffering and the negative part is already taken, and lot of research has already gone into it. So, positive psychology focuses on the other aspects of it, so that we can have a full spectrum of human experiences, because this aspect was neglected in the other subdisciplines of psychology, more specifically clinical psychology and so on. So, positive psychology addresses the other neglected part of human experience, which is positive experiences or well-being and flourishing in life and so on. So, positive psychology looks at full spectrum of human experiences from and embracing the negatives and other things also, acknowledging that also. So, it focuses on cultivating mindset, habits, relationship, foster well-being and so on. So, this is what we should remember. Positive psychology, when we talk about it, is not just about only positive, it also acknowledges the other part. Focus is given because this was not given enough attention in the other earlier researches and other subdisciplines of psychology. So, thank you for being part of this journey, and I hope it has been as meaningful and inspiring for you as it was designed to be. So, with that I stop here. Thank you.